We're back with Real Men Wear Gowns. It's our campaign to get men to put on that hospital gown, get that scan, take their health seriously, and be proactive. And we're here to talk about something I had never heard of before, which is called holiday heart syndrome. And Dr. George Lolay, cardiologist with Franciscan Health, is here to tell us what exactly that is. So I'm guessing this is a name for something that's more common, right?
Yes.
Okay.
So first, thank you for having me
Yeah,
here.
thanks for being here.
Holiday heart syndrome essentially is an abnormal heart rhythm.
Okay.
And the healthcare providers refer to it as usually atrial fibrillation or atrial flutter. And so what patients notice is a sudden onset of fast, irregular heartbeat. So they would notice fluttering, palpitations in their chest. Usually it happens after a significant amount of alcohol consumption, sometimes significant food intake. And yeah, so
that's why I'm guessing that's why it's called holiday heart syndrome, is because this is the time of year when we get together with friends, family, we're going to parties, we're eating a lot, perhaps drinking.
Yeah, and so it's a lot of studies have shown that during the holidays, Thanksgiving, Christmas, and New Year, there has been an uptick in the number of otherwise healthy individuals who would show up to the ER with this problem. So they would present, they're short of breath, their heart rate is fast, or they're having chest pain, and it turns out they're having atrial fibrillation or atrial flutter. And that's where the name came from.
And so what's the danger with that?
Great question. So these abnormal heart rhythms carries or bring high risk for having strokes. That's one thing. It might compromise your overall blood pressure. And so they should not be taken lightly. If you're having fluttering or fast heart rates, I would advise you to seek further care. But if you're having persistent chest pain or shortness of breath, the best thing that you can do at that time is present to an emergency room for further evaluation, because it could be that, it could be something more serious. But the take-home message is don't ignore your symptoms.
Yeah, and so if you do have those symptoms and you show up and they say, yes, this is a-fib,
Yeah.
holiday heart syndrome, what can be done about it? What do you do?
Great question. So usually if you're an otherwise healthy individual, we would hope that as that alcohol or whatever stressor you had during the holidays washes out of your system, your heart would convert back into a regular heart rhythm. If that does not happen, then we have a lot to offer. So we can offer meds that would lower the heart rate, increase the odds of converting back into a regular rhythm. And if that doesn't work, then we would have to put patient to sleep and shock them essentially back into a regular rhythm.
And how do you prevent this in the first place?
Good question. You know, I like to think, let me put it this way, I like to think of the holiday season as a time of grace and gratitude. Interestingly, it's been more about abundance, and so we overdo things. And so what I tell people, especially nowadays when they show up to my clinic, use this time to slow down, spend quality time with the people you like, and in that spirit, prevention becomes simple. So be reasonable with what you drink, maybe skip drinking altogether during that time of the year. Portion control, eat less, stay hydrated. I'm sure you want to have fun, we all do, but don't stay up late at night. And use this time off to maybe put an aerobic exercise together. These symptoms or these problems, yes, they come abruptly, but they've been, you've been subjecting your heart for stressors for a long period of time.
Yeah. All right. Dr. George Lolay with Franciscan Health, thank you so much for letting us know about this.